Welcome to our newsletter. It's Mark Allen's one-on-one for the newsletter this month, and this month we're doing something a little more serious, is the fact we want to stay along the lines of COVID-19 and how important it is, and to get some information out there to you. And our guest for one-on-one today is Tony Janus. Tony, thanks for joining us.
Thank you.
We've picked Tony to talk to this month because Tony is a regular on our open line program on KTRF twice monthly on the second and fourth Fridays at 11 o'clock, and we talk a lot about health issues, and Tony is our go-to guy for health. So, Tony, let's talk about the health of everybody right now, and that's
okay.
COVID-19 and some of the things we need to know about COVID-19. What are some of the more important things that we as the public need to know?
I think most importantly, people really need to know what it really is and how it spreads. Because there's a lot of misinformation out there with you can touch a box and then all of a sudden you're going to get sick because it lives for a couple of days on the box, and that's what's scaring a lot of people, and fear is usually not good when it comes to situations like this. So kind of to explain it in a real simple matter, somebody who has been infected with the virus, whether they show signs and symptoms or not, if they cough, or if they sneeze, or even just through regular talking, they expel it out through little water droplets. Now, if you're closer than 6 feet, you can breathe that in, and you can then get infected with it. Otherwise, the usually droplet radius is about 3 feet, unless you've really got a heck of a sneeze, and then then it goes a little bit further. So that's why this social distancing thing is coming about. It's giving you that extra distance between. If it lands on the ground, it's gone. I mean, it's not going to survive after that. There are certain things like plastics and cardboards and things like that, glass, where it does live a little bit longer. But it's not active. So if you touch it, as long as you're washing your hands and you're using hand sanitizer, especially with washing your hands with warm water, anything above 80 degrees, it's going to kill the virus out. It isn't heat resistant, so it'll kill the virus off as long as you do a good job of washing your hands, so you're good. The problem is that you would have to actually touch the box, and then you would have to not wash your hands and either put your fingers in your mouth, or it's really with the eyes, because it can be absorbed through the eyes itself. Once it gets into your body, it connects up with the chemicals in your body that causes cells to replicate, and that reactivates it, and that's what causes it to grow. So really, if you're practicing the social distance and you're doing continual hand washing and doing the hand sanitizer, whenever you get your mail or you get a package, always wash your hands, you should be pretty safe with not getting infected with the virus. There's a lot of that you can do.
Okay. One of the things that people see a lot in the news is face masks, some kind of mask. How important is a mask, and is it something that we should all be wearing, or is it just more important for those that are infected? Or the health community, as in doctors and nurses? It's
always important for the doctors and nurses, and we've gone to it also in our facility, wearing the masks, just because we're in and out all of the time, and we come in contact with it as a precaution. There really isn't any hard data out there that says that the masks are definitely going to prevent you from getting it or are much better. I would suggest, especially if you're somebody who has COPD or asthma or anything dealing with your lungs, heart disease, diabetes, whatever your age group, probably not a bad idea if you're out in public to wear the mask, just because it gives you that extra layer of protection.
I think I heard the Surgeon General mention the fact that if everybody started wearing masks, it would be a false sense of security, and then we'd start touching our face more often, and this actually, he said, would be counterproductive then.
It would be, and one of the examples I had today was I had the face mask on, and all of a sudden my nose started to itch, so I had that urge to pull it forward and scratch my nose, and then I realized, oh, wait a minute, I shouldn't be doing that. So yeah, it does give you that false sense of security. So I'm not going to say no, don't do it. If it makes you feel better, certainly do it. If you're immunocompromised, I would recommend it this time of year, every year, to wear a mask because the flu would pass the same way.
I know we're still waiting for some kind of a serum, some kind of cure, something out there that's going to help us in the long run. And we're still a little ways away, although there are some good things happening out there, some positive notes.
There are some positive notes. People just have to be smart with it. When it was mentioned that chloroquine was effective, it's showing more through anecdotal, and they're starting to come out with more and more studies that are showing that it is becoming very, very effective. But nothing as far as pure clinical trials yet, so some people are a little bit afraid of it. The issue is that it's a medication that has to be dosed based on your height, on your weight, and any other comorbidities that you have. And those that are overdosing on it are those that are just taking extremely large amounts of it. The one drank the fish tank cleaner stuff that had it in it, and so you have to be able to have it supervised by a physician. And basically, in a nutshell, how does it work? The earlier comment that I had, where the virus gets into your body and it attaches itself to the stuff that helps it replicate. The chloroquine blocks the virus from being able to connect to that chemical that causes it to replicate, so it can get in your body, but it can't spread.
Okay, a lot of misinformation out there as well. So, is there certain places like the CDC or some other places you'd recommend to go for information?
The CDC is really good to go to the information. The Minnesota Department of Health is real good at looking at the information and a lot of the new updates that are coming out. I go to was it Worldovision, that has it's worldovision.info. It has all the data throughout the entire United States and the world as to how many cases are out there, how many deaths are happening. It has plenty of graphs for you to take a look at and see tracking and trending. It's updated every 4 hours based on Greenwich Mean Time. So if you check it out at about 5 to 6 o'clock our time in the evening, then you would see what the end of the day statistics are. But the CDC is usually the best, but not all of them really agree on a lot of things.
Yeah.
But
well, still a lot known. There's just a lot unknown still.
Yeah. I mean, there's a lot of things we don't know that we don't know. And that's the big deal. Is the biggest scare now is that, okay, now that you've had it, do you have immunity to it?
Right.
Now Dr. Fauci is pretty confident that yes, once you've had it, you've built up an immunity to it, and you may not get it again, or it would be a mild case. But here again, there's still no hard data, and people are worried that it would up itself and start to infect more people again and do a second round, and there's no indication at this point that that's happening.
One thing we know is it affects the older population and those with compromised immune systems.
It does, especially because they are compromised because of some other disease state that they have, like we had mentioned, the breathing issues, the heart issues, diabetes, those things that reduce their ability to fight off the immune system. So,
Tony Janus is our guest on One-on-One with Mark Allen today. And Tony, just in wrapping it up, just some things of common sense for folks. Again, it's the simple things. If we do a lot of common sense stuff, follow the guidelines, and if we all follow them, maybe the sooner we can get through this.
Absolutely, and you really have to pay attention to what you're doing. This last weekend, I found it great that people were out walking on the paths and having the family out there walking the dog, but I also noticed a lot of people that they think because they're outside they don't have to practice the social distancing, and I saw a lot of people congregating around cars having a conversation in the parking lot where the paths are. Those are a lot of the things.
You still want to keep that distance?
You still want to keep that distance. Handshaking, I mean, you can do the fist bump, but the handshaking you can't do. No hugging, just because that's going to spread it. So a lot of it is just thinking a little bit and changing your mindset, because these are habits that's always not a bad idea.
Okay, and family members, it's okay with in your immediate family, husband, wife, son, daughter, and whatnot, but you don't want to get too big of a family together?
You don't. If they don't currently live in your house now, don't bring them in the house. I mean, just because they're coming from somewhere else and has a potential to spread that out, because then you're exposed to somebody you hadn't been before and could go back out into the community and spread it because it came from somewhere else. So yeah, try not to have family come visit.
Okay, and it's and kind of winding things down here. It seems that the like Sanford Health and those doctors are saying if you before you come in, always call, right?
Right. Yeah, because they want to be able to screen you a little bit to find out if you do have the signs and symptoms and whether you need to be seen, or whether you can get online and actually do kind of an online visit, and they'll ask you questions. So they want to be able to screen you, just because if in fact they think you are infected, then they'll want to bring you in without infecting the people in the building that aren't. So there's precautions that they have to take.
And one of the biggest things, don't panic, right?
Absolutely, absolutely. Panic is something that really created a lot of havoc for the people that are the most vulnerable. I mean, taking all the toilet paper and then having your elderly not have access to it, that really hurts those people that are vulnerable.
And we still don't know why. I mean,
no.
It's just a lot of it doesn't make sense. Tony, thanks so much for coming. I appreciate it.
Thank you.
That is our one-on-one this month on a newsletter. Tony Janus from the Thief River Care Center, our guest today, and thanks for joining us again for another edition of One-on-One with Mark Allen.